The next speaker who's going to talk to us here today is going to give, well, let's say it's going to be a presentation unlike any other presentation you've seen in the past. It's a view from the front line, a view from the emergency department. And I'm delighted to say that we have here today Dr. Gerry Lane, a consultant in emergency medicine from Letterkenny General Hospital, who is going to talk to us today about what happens after a car crash and when the ambulance pulls outside the front door of the hospital.
Thank you. I came in my working clothes. Can I just ask for your attention for a second? Can you guys at the back hear that? Yeah. They asked me to make this a bit personal. Put a face on this. I was lying in bed last night, couldn't sleep, because all these faces came into my mind of guys I've met in the last 20 or 30 years who were injured or who died. And I said, well, what will I tell them about? Will I tell them about the jigsaw man, the man who came in 5 body bags? Will I tell them about the lady who had no legs, because her legs came in a second ambulance? And then I thought I'd tell you about the sugar cube kid. Imagine you have some sugar lumps in your hand. Try it at coffee and just roll the sugar lumps between your fingers, just like that. And that's exactly what the skull and bones of small children feel like when they've been chucked out the window of a vehicle. So I'm here on behalf of the Irish Association of Emergency Medicine, the HSE, the Road Safety Authority, to tell you about the view that we and many of the first-line responders, the fire service, the ambulance service, An Garda Síochána, who go out to these roadside events, actually feel. And we're not particularly happy bunnies. In general, we're frustrated, exasperated, and incensed because it's going on. I'm not annoyed at the guys I work with. They're pretty cool. I'm not annoyed at having to stick tubes into people. That's pretty cool. I don't even get annoyed when I have to do that to people. But what I do get annoyed about is the fact that these are not accidents. These are not acts of a malevolent God. These are the acts of human beings, people. And I was thinking about all these faces last night, and I was lying in bed, and all these faces kept coming at me and coming at me. And I couldn't think of any of them that weren't avoidable. I couldn't think of any of them that weren't preventable. Very, very few. So the reason why I'm here isn't because of the 1 or the 2 or the 10 or the 20 or the 100 people who have died in our roads recently. I'm talking to you about the 300 people who died last year or more. I was typing this in when I was doing this presentation. I got to March 2006. I got fed up. I couldn't take it anymore, Couldn't see the computer anymore. So I had to move on. So those are the people I'm here for. It ain't an accident. It ain't an accident. It ain't the work of a malevolent God. The British Medical Journal, a very well-respected medical journal, they don't use the word accident anymore. It's gone. Here in Ireland, we don't talk about A&Es anymore. We took out the accident because when we realized it was people. So since 2000, you drive around, you'll see emergency department. We've left out the accident. People are not off the hook. This is a people problem. And by gum, we ain't casual about it at all. We've heard that things are getting better. Our death rates are coming down. Our fatalities are reducing per million vehicles. We've heard today that things have improved over the last number of years, and we're now inside the top 10. And we are voted most likely, biggest change recently. But there is Ireland. My apologies. There's Ireland here. none of us in our job want to be just good enough or middle of the road or be rated as average. We want to be super in our jobs. We wouldn't be sitting here unless we wanted to do things right and do it well to the very best of our ability. So where do we as a country need to go? Down here, down to where the best practice lies. So, the take-home message from me today is I am totally behind the speakers from earlier on. I am totally behind the call for reduction in breath alcohol concentration. I am totally behind the widespread introduction and enforcement of safety cameras, because to me they ain't speed cameras, to me they're safety cameras, and I'll tell you why it's important to me in a second. I live up here. This is a map of road collision, road crash, serious injuries. So in order for me to get down to meet you guys, I have to come through the bandit territory of this dark blue area, down to this nice safe neighborhood. And then I get in my car and I drive all the way back up. This is really, really personal for me. There's in Ishoan a tiny part of the country, but disproportionately represented in our media because of the horrific, multiple, and when I say multiple, I mean 4, 5, 6 people dying simultaneous vehicle collisions over the last several years. In fact, our local coroner, John Madden, was in the Irish Times on Saturday. He said, "This is crazy, guys. I've got 15 more deaths on my books. I can't get through these guys. Too many young people are dying on the roads in my area." And this is a totally dangerous area. But it ain't just there, it's all around. Donegal, pretty good at football, pretty good at scenery, and we're bronze medal holders on the Death League. Bronze medal holders in the Death League, which is pretty crap, really, when you think there are only 140,000 of us. And Cork's got 500,000, and Dublin's got 1.25 million, and we're still third, just behind those guys. Earlier on it was said that deaths disguise the reality, and yes, deaths are real, and they're disproportionate amongst the blue drivers and the red passengers, and it's the young guys mostly, the young people, and then there's a raise in the older person, and pedestrians are disproportionately represented in the elderly, but they're just the tip of the iceberg. I don't particularly like the old death football league either. But behind that is the 10-to-1, 20-to-1 injury to death ratio. I don't see a huge number of dead bodies anymore. They don't come to the emergency departments. They're the subject of scenes of crime investigation and forensic crash analysis. So they're left on the roadside while the investigation is going through. But what I do see is that in 2006, for the 19 deaths, 444 people were seriously injured and came into my teeny tiny bijou emergency department, which only has 5 cubicles. Thank God, they didn't all come at once. So I did a bit of analysis on what's happening in my little teeny tiny hospital up in the top left of the country. And I left out all the deads and the criticals, okay? We're just talking about the moderates and severes here. Only 33,000 people come to my emergency department every year. That's a quarter of the population of the area. 33,000 come. But of that, more than 1,000 of them were there avoidably, predictably, because of road traffic collisions. 1 in 3. They didn't need to come if they hadn't been involved in that collision. There were 320 people brought up into the wards and put in beds, and on average they were kept there 3 days. Now we're leaving out the critical guys. We're leaving out the most severely injured. We're leaving out the dead guys. We're talking about the mild and the moderate injuries. And we used up more than 1,000 bed days. 1,000 bed days. Hey, I got trolleys out the door with little old ladies with pneumonia, and little old men with broken hips, and little kids who are sick. I can't get them into the hospital because I have no beds. And it strikes me, in this environment, especially coming up to tomorrow, where one of my wards has been closed and where there's another 12 bed closures scheduled in my hospital, that perhaps I could be doing something more useful with these bed days, because they're avoidable. You can't avoid pneumonia, really. You can't really. But road traffic collisions, you can avoid. No surprises to anybody. We're a microcosm of the country. Average age is 18. It's a young person's illness. But what we have in our hospital is we get all age ranges. I am so fed up of seeing dead kids. I've had a bad 3 months there just a while ago. I had 3 dead kids in 7 days. This is not fun for anybody. My entire department and all the staff in it are absolutely wrecked. Mentally and physically wrecked. You're with a kid for maybe an hour, 2 hours, they die, avoidably. Well, you don't really want to see the next guy with ingrown toenail, I'll tell you. The cost is not just the family, not just the community. It's not just the kid. It's everybody. But it's also your healthcare workers who burn out and burn out bad. There's just so much of this stuff you can take, especially when you know most of it is preventable. Money. Don't you love it? Tomorrow is going to be cool. 2006, €1.5 billion on road accidents. €1.5 billion in road accidents. And up in my little county, I've already said we've closed the ward. I've already said we're going to close another 12 beds. Why? We're 1 million over on a 112 million budget. We're 1 million over in a 112 budget. 1 million. Average cost of a fatality on our roads. 2006, 55 million is what it cost Donegal. We're closing wards because we're 1 million over. Road collisions, nearly all avoidable, cost 55 million. There are very positive things we could do with that money. This is the good Dr. Haddon. Dr. Haddon worked out the risk matrix. There are humans, vehicles, and the environment involved in any collision. And we can talk about pre-crash, crash, and post-crash events. Rick has already shown you this on one of his slides, and most of the professionals will recognize this very well. Now, this is where medicine comes in. Okay? That's ambulance services, helicopters, advanced paramedics, emergency departments, surgery, blood bank, rehab, CT scanners, blah, 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 blah. We're all here after that. So what I'd say to you is that this is a huge problem. It's a worldwide epidemic. At the time I've been talking, maybe about 150 people have died because somebody's dying every 6 seconds across the world, according to the UN. There are simple, simple truths. And the simple truths are, okay, it's all right to blame the road occasionally. Okay, it's all right to blame the car or the vehicle occasionally. But hey guys, it's a people problem. This is a people problem. Our road collisions are a people problem. Those are the 4 factors I would pick up. But there's nothing new there. We all knew this anyway. Speed for situation, driver impairment due to alcohol, drugs, or tiredness, or other factors, including mobile phone use, our low rate of seatbelt use, and ever present is the guy who's just 6 inches off your rear bumper, chasing you down the road, and he will overtake you if there's even half a second of a chance. The guy who's flashing away at you because he's not functioning and you're not functioning either. Simple stuff, simple truths, not rocket science. We've done that. The sugar cube baby. That's how you end up if you go through your front windshield at 60 miles per hour, 100 kilometers per hour, you end up like a sugar cube, you feel like a sugar cube. Seatbelts, there is no bad side to it. This is coming to a neighbourhood near you. I was tailgated up to the airport this morning by a guy. I was doing about 100 kilometres an hour. He was doing about 140 when he overtook me on dual white lines. He had been on my tail for about 5 minutes, flashing me. I don't know where the heck he was going to or where he was coming from, but he was a crash waiting to happen. There's a lethal equation here, and it's already been talked about by Declan Bedford. Basically, it's boy or girl meets pint, has car keys. Now, a more sensible equation would be boy, girl, get together and leave the rest behind, but that's not going to happen. This and this are part of our lethal equation, and that has to be broken. The World Health Organization have recognized this is a huge public health issue, Can you imagine in Ireland if 300 people a year died of measles? Could you imagine if 300 people a year died of meningitis or mumps or anything like that? But more than 300 a year, more than 300 people are going to die this year, avoidably and preventably from road traffic collisions. So a systematic approach is required, and we've already seen elements of that today. And together, in a multidisciplinary way, we have to identify the source of errors. And primarily, that's got to do with people. And we need to design out the weaknesses in our systems which allow these people to have their collisions. And we need to design in safety, and that's into our education, into our enforcement, into our engineering. Education is good. But as was said earlier on, the high-risk people find it difficult to be educated. Engineering, absolutely. That's vehicle and roads. And enforcement, absolutely. Of current legislation, and I'll take this opportunity to put my heartfelt plea in front of you, and in front of anybody else who's listening. What we need now is an urgent reduction in breath alcohol concentration down to a maximum of 50, and the urgent and widespread introduction of safety cameras. They're not speed cameras. This is bad PR. This is spin. This is a safety camera. It'll pay for itself. It'll pay for itself very rapidly as those fatalities go down. So today, take-home message from me, and it's the same message, I think, from everybody. Breath alcohol concentration down, safety cameras in. It's all very good to say that we have to break that lethal equation. Primarily, it is an issue of personal responsibility, but sometimes we have got to help people make the right decision. The example was made earlier on about the lawnmower. You need parents watching over, or significant others. We have got to give good example. The older, so-called more responsible people must give good example. Buddy support, well, we all hear about peer pressure, primarily in a negative way. But buddy support or peer pressure in a positive way works in many European countries, such as Belgium. I believe we have to get off the fence regarding our ambivalence. As a nation, I believe we are ambivalent towards drunken and speeding drivers. I believe we are ambivalent towards people who are impaired while driving. We need to get off that fence, and we need to say, do not drink and drive. Turn off your phone before you start your vehicle up. Don't take drugs and drive off in your vehicle. And deterrence. Well, there is a truism. People respect what the Gardaí inspects. Okay? You've heard that before. People respect what the police or An Gardaí inspect. So I say, give to An Garda Síochána the weapons that they need. Give them the tools to do the job. Reduce that breath alcohol limit. Give them those safety cameras so they can get on and support people in their own strive for personal responsibility. This Road Safety Week is tremendously welcome. It's tremendously welcome to me, to my colleagues that I represent up in Letterkenny and in the emergency departments around this country, and to the whole HSE, because the amount of resource that avoidable road collisions consume within the HSE is extraordinary and cannot really be quantified. But the numbers are in the millions and billions. They are a huge amount of resource. So let's step forward after this into Road Safety Week and reduce those deaths, because there are simple truths. I think questions will be held at the end. And what I'll say to you now is my message is fairly simple. I'm here not just talking for myself or the emergency department consultants or for the HSE. I'm talking for the thousands and thousands and thousands of people who could be on that list if I could have typed them all in, but I had to stop because I couldn't see anymore because the tears were blinding me. But I'm particularly saying it to you for this kid. I can't remember the kid's name. I can barely remember the details a couple of years ago. But the actual sensation of that child's bones under my hand was exactly as you will feel later on when you get 3 or 4 sugar lumps in your hand and you just roll them round. Because that kid wasn't just a dead kid. That kid was a broken kid. A broken child, completely avoidable, completely preventable. And I don't want to go back to work and see another one of those broken children. Thank you very much for your kind attention.